James and Maria, thank you so much for that presentation and demonstration of how easy it is to use and how truly accurate it is. The fact that, Maria, everything you stated was shown, and removing some of the little nuances that you mentioned, exactly what James had said. What is the basics of DAX Copilot, Bonnie?
Thank you, Coletta. We appreciate the opportunity to be a part of your AI scribing discussion today. DAX Copilot, developed by Microsoft, aims to assist administrators in addressing staffing shortages driven by a growing aging population, poor patient experiences, and increased provider burnout. As you and your audience know, administrative burdens compound these issues, with clinicians spending up to 2 hours on administrative tasks for each hour of care provided. Our award-winning AI is built on a rich clinical data set anchored in more than 1 billion minutes of medical dictation annually and more than 15 million ambient encounters. DAX Copilot enables behavioral health professionals to capture the complete patient story, producing a clinically relevant summary SOAP note in seconds. Some of the feedback we are receiving from DAX users include the ability to create appointments that actually run on time, to be able to focus on the patient as DAX Copilot captures the notes from the exam automatically, having a personalized AI generated note, and also DAX Copilot eliminates cognitive burden as the SOAP note and transcript are stored securely within DAX Copilot.
Hey, Bonnie, thank you so much for that. So, Maria, being that, we specialize in behavioral health and substance use disorder, and the volumes of documentation that staff members are required to do, clinicians are required to do. How beneficial do you see this product, being that you've had your hands in, you've worked closely with Bonnie's team?
In any realm of healthcare, the interaction with the patient is very important, but I think especially when you work with behavioral health and mental health, you have a different level of vulnerability and a topic at hand. So the fact that the DAX Copilot enables the provider to truly focus on their interaction with the patient and gather the context of the conversation without having to focus on taking their notes, clicking as they go, and just truly have a natural conversation that has been populated into a very thorough note that fills the appropriate sections within a system. They aren't having to worry about their documentation while they're meeting with their patient. They're able to focus on their task at hand, knowing that at the same time their guidelines, their requirements are still met, all the way through meeting their documentation requirements, taking care of the patient, and following through to billing.
Maria, you highlight a very important point in that the attention to the client, the patient, and their thoughts, their words. Bonnie, can you highlight that within DAX Copilot? The fact that not only is it supporting the provider's narrative, but how it's amazing how it also captures so perfectly that client-patient discussion as well.
I can absolutely do that. It's, as I had mentioned a little bit earlier, there are 3 components of the DAX Copilot. It has the smartphone app that allows you to record that patient encounter. The patient encounter actually turns into a SOAP note that is available for immediate review, and then transferring into the AZZLY EHR. It allows for that patient engagement. It allows the provider to finish notes timely, and provides for easy and efficient billing.
So, Bonnie, you see a big cost savings, I imagine, for individuals that use this product, because they don't have to have a scribe and they don't have to use transcription services, right?
That is correct. So it is absolutely much more cost effective than an in-person scribe, and the availability, it's available 24/7.
Excellent, great. Maria, if someone's already using AZZLY Rize as their electronic health record, are they able to document DAX Copilot easier it's an easy adaptation. It doesn't take it doesn't take a wizard to do.
It's one of the things I was most impressed by during the demo, Coletta, was the ability, well, first, the way that it populated the appropriate sections within the Copilot for the history, talking about the assessment and the plan. At the end of our demonstration, when we were going through the practice for this webinar, when James was finished, he said, insert history, insert assessment, and it populated immediately into the recognized fields within AZZLY. So those notes were populated very seamlessly. And do you mind if I share, kind of off topic, I go off script sometimes, but a part of the demo that I was most impressed by, and that was, I was playing a little bit because it was a practice run, but during part of the assessment, I was asked, have you had any, along with many other questions, have you had any suicidal or homicidal thoughts, since we last met? And I said, no, of course I haven't had any thoughts of harming myself, but the homicidal, I don't know, maybe depends on the day. And I was kind of joking, Coletta, but actually when it did transcribe the note, it caught the tone of that message. And so it actually did transcribe as negative, for suicidal ideations, negative for homicidal, because it knew that the context. And so that, I think, was the moment during our practice that most impressed me with DAX, was how it really does take that personal feel and puts it into words rather than just a flat robotic transcription.
Excellent. Maria, thanks for sharing that. Bonnie, we received a lot of questions about the safety of using AI, ensuring that it's HIPAA compliant, ensuring that, the individual providing the service gets paid, that it's got enough detailed information. Can you talk a little bit more about that?
Sure. Security and compliance are extremely important to Microsoft. Part of the Microsoft Cloud for Healthcare and the Copilot ecosystem is delivered through a trusted infrastructure and global platform, guided by an established, responsible AI framework and core set of principles. The DAX Copilot offers enhanced security using Microsoft Azure, the world's largest multi-terabit global network, operating through a network of 10 secure, redundant, local, regional servers in the continental US. The Microsoft Azure environment is HITRUST certified, ensuring data privacy and security. And this is very important to your viewers. All data is de-identified to protect client privacy during data utilization and storage. I hope that answers your question.
Yeah, it's huge. It's huge because as a EHR vendor, we have to be comfortable and confident with that. And all of our users, it's the first priority is patient health information and the safety and security of that. Maria, you go on site quite a bit with some of the larger facilities. I've enjoyed it very much. We meet a lot of just incredibly experienced psychiatrists, psychologists, those that have spent years in the industry and are quite talented, but they're used to doing things their way. It may be on paper, it may be using a scribe, a transcriptionist. But what I found in many of the visits that we did, they remember Dragon. They know Dragon. They've used it somewhere, someplace. And if you ask a psychiatrist, and many mental health and even residential programs, they may not have a need of a full-time psychiatrist. So they'll utilize from their community maybe more than one. And they're either still on paper in their practice or using an EHR, or they're affiliated with the hospital using an EHR, or they're affiliated with other facilities or treatment centers using an EHR. And so you tend to get pushback. Sometimes we've heard pushback, right? And saying, another one. But I feel that if it's presented the right way for anyone who is not comfortable with technology, first step is right. Dragon, right, Bonnie? They have to be comfortable using Dragon, and then introducing the Copilot is like a natural second step. Maria, do you think that the reception will be stronger, better? You'll be able to convince this generation of individuals who, push back on EHRs. Do you think it's so intuitive that they'll use it?
You know, when you mentioned this generation, I think that this generation buys in a little bit easier because they were brought up with EHRs. However, you do have the generation that, like you said, they come from paper, they come from that other background. And, you know, as much as we try to help as an EHR, anytime you have EHR, you're going to add clicks because that's what we do on a computer. So being able to go back to a realm where we have some more simplified note context areas so that they can click in an area and dictate directly into it, I think will, for especially the generation who they're seasoned and they're still loving that passion of what they're doing. I believe that being able to use this not only will help that generation, this generation, they're embracing AI, they love it. So I really see how it kind of bridges the gap between the two and enables the documentation to become an enjoyable experience again, rather than just a necessary evil in order for reimbursement. You know, they get to do what they love, interacting with their patient in a natural way, knowing that all of their data is being captured and populated in a professional format that's presentable and reimbursable.
Yeah, excellent. Very good points, Maria. You know,
I wanted to throw in some feedback we're getting from our DAX clients, if that's okay. If you
oh,
have some
please,
time for
yes.
that. Okay,
Yes.
great. So we're seeing an overall and positive improvement on care delivery, such as a 7-minute per visit savings, reducing documentation time by up to 50%. Some are reporting. Some are up to 70% are reporting a reduction in feelings of burnout and fatigue. So that's another important
Huge.
factor. And then 85% of the patients surveyed feel that the clinicians are more personable and conversational when using DAX Copilot. So we thought that that was relevant. And then also Atrium Health just completed a survey on DAX Copilot. Most of their providers are using, and 92% of their clinicians said that DAX Copilot is easy to use. So it would be an easy to use add-on to Dragon Medical One. And that obviously a high percentage reported an improved documentation experience. And believe it or not, 85% said that they would be disappointed if they no longer had access to DAX Copilot. So we thought that was interesting as well. And as Maria mentioned earlier, it does eliminate the banter. It brings the clinically relevant information into that SOAP note and eliminates all of the banter. So it's truly remarkable. And it's one of the only solutions out there that also not only has the SOAP note available, but the transcript available as well. And that's what helps with the cognitive, you know, the ability to recollect and go back. If there was something that was said during a patient visit, you wanted to go back and listen to the visit, incorporate it into the SOAP note, you can do that.
Excellent,
Very
excellent.
good.
Bonnie, thanks for sharing. Those are phenomenal statistics. I'm not surprised. Having seen it, I'm not. Integration of AI-driven technologies, Dragon and EHR, especially after returning to work with physical limitations that may impede typing. Does this solution support that? So Matt, do you want to address that?
Yes, yes, the combination of Dragon Medical One and DAX Copilot will eliminate typing from your workflow. You'll still need to point and click to focus the cursor, as we say. You'll have to move the mouse a little bit, but there will be no typing required.
Excellent, great. Maria, how do you see, oh, here's one, want to gain knowledge on how I can improve documentation and save time?
I think we covered that a lot during this call, you know, just to expound on that a little bit. And I think the demo will speak for itself in a way, because the intuitiveness of the software, what it picks up in the conversation, whether it's mood, the tone of the conversation, the things that are being said and unsaid, that it really does pick up on and put into words. I think that it will improve the documentation by those things that we tend to miss, you know, in the moment of a conversation. When I go back and I reflect as a nurse and I'm completing my documentation, for example, I'm remembering those key facts, you know, that were some kind of milestones in the note. But then those small, whether it's comments, the gestures, the tones that were missed because I couldn't capture everything all in one, but Dictation is live. It's listening to the entire conversation. It's picking up on all of it in one. So it really completes that or inserts that complete note in a very thorough way. And it saves time because it's instant. As you'll see on the demonstration, as soon as we were finished, you can begin inserting that into your note and you're done. It took less than, I would say, about 60 seconds to have the note completed after finishing that, for sure. And just to talk on that, not only did it capture the conversation that we had, they have what's called a monologue that the provider is able to complete after the session. So when you go back and you would normally be adding your own comments about the note and your plan for the patient, it intuitively inserts those into the appropriate places of the documentation so that it looks natural and flows. It's not segmented. So it's a very thorough note that reads well.
Great, and I think you just answered this next one. If I'm taking a note during a session, will this technology use my bullet point notes to create a comprehensive HPI? So I don't know if Matt, you want to touch on that one?
So the kind of part of the purpose with DAX Copilot is to eliminate the need for you to do that note taking. Using verbalization and AI coaching, you're able to train DAX Copilot to produce the note the way you want to see it. You're of course welcome to take notes as you'd like to double check everything as you get used to it, but our trainers will work with you to make sure the things you want to see within DAX Copilot are what is showing up within that soap note.
Here's one. AI adds additional information to a record in its own words. Is that of concern?
So it does. Oh, sorry, was that a Matt or a Maria question?
Yeah, Matt or Maria.
Go ahead, Matt, you're the expert.
So it does summarize based off the conversation, but you are able to add, if you wanted to add a quote or anything like that, you're able to add direct text as well. And then when you go to transfer the text, that summary, if there is something you also wanted to add, you can use Dragon at that time to do the speech to text as well.
My impression wasn't that it inserted words. I think of it as though back in school when I may have written a paper and I thought it sounded great, if my English teacher had rewritten it with a little bit better vocabulary, punctuation, and grammar, and it just conveyed the same information, but it just sounded better and rolled better. It really was very accurate to the point of the conversation.
Yeah, it's almost like spell check, right, Maria?
Exactly. It was very convenient, but I didn't notice anything that didn't sound natural.
Excellent, great, good feedback. Do you provide any documents? Maria, you want to clarify on that as far as, like, we have the master library of forms?
We have an incredible master library of forms that are appropriate for behavioral health, substance abuse, mental health, eating disorders, psychiatric rehabilitation programs. The list goes on. And those are reviewed on an annual basis to make sure that they're compliant with both Joint Commission and CARF. So our library is very thorough, and it's simple for us to take a form that may have been full of drop downs and check boxes and turn those into some simple text fields if preferred. You can have a combination. It's very compatible with the Copilot to the extent that you would like to utilize it.
Yeah, excellent. Hey, Matt, here's one for you. What about HIPAA and data being stored or being sold for big data mining?
So it is, as Bonnie mentioned, it's HITRUST along with 3 other major security designations through Azure. That is definitely not something they are interested. So all of your data and privacy, it's beyond HIPAA compliant. Everything will be secure and safe.
Excellent. We're up in Microsoft's private cloud network, Azure, and I know obviously this is a Microsoft product, so we know where everything's being stored as well, which is excellent. The HIPAA, PHI, I think Bonnie touched upon it earlier. It's so secure and safe the way that they've set this up. I'm really impressed with it. So Matt, I don't know if you want to add anything more on PHI, on HIPAA, and on security.
No, the HITRUST certification is usually what the CIOs like to hear. That's the ultimate in security designation. So it is meeting that requirement.
I would assume that's what you get with the dragon name, right, Bonnie?
There you go. There you go. Bonnie, maybe this one for you. How are users handling the need to get a consent from a patient? Do you know how they're addressing that?
So officially, we're supposed to say that they should consult with their legal counsel, but from what the feedback we're receiving, either they can have some type of disclaimer that they sign off, a waiver that they sign off when they check in, or the provider can simply ask them, I will be recording this session. Are you okay with that? That way I can have a more meaningful conversation with you. And usually a verbal consent will suffice as well. Yeah, I think it all depends on the state you're in and the legal requirements and everything for things like that.
May I piggyback on that, Coletta, too, with our
Yes.
document library? Any of those requirements that a state may have, that's very easy for us to incorporate into your standard documentation within our system. So if you would like to have that consent as part of your admission packet, then that's very easy for us to incorporate so that you're always covered.
Excellent. Yeah, and I know heavy, obviously, if you're Joint Commission accredited or if you're CARF or COA, having your manuals and disclosing in your manuals your process. And also, as Maria said, on any type consent that you do, consent to treat, having that disclosure there that you may be using, Dragon or DAX Copilot, even in your telehealth, it's best to be transparent and disclose. And as Bonnie, you shared with statistics, I think individuals that are in a session are going to highly appreciate not having their provider typing away while they're speaking and being able to just have it transposed. I was blown away. I really was blown away with that. Bonnie and James have a wonderful opportunity, as I mentioned, and Matt, as I mentioned earlier, their team has a trial opportunity that they're offering all AZZLY users. And as I say, they've worked with Maria, they know our product. It's very intuitive. Bonnie, it's a combination of Dragon and Copilot, right? As far as the subscription that they would have to utilize in order for it to work.
Yes, that is correct. So if they are not a current Dragon Medical One user, we will issue not only the Dragon Medical One trial license, but also the DAX Copilot trial license. So that will be done in tandem.
Excellent, great. So we will be putting up a QR code and additional information on how to access that. Bonnie, James, Maria, team, thank you so much. We're very excited about being a preferred partner with First Dragon and really encouraging all those that are frustrated with electronic health records and love the narrative and the ease of use of that to please consider a trial and check it out. Thank you. Have a great day.
Thank you.